Hello everyone, how are you all? Hope you all are very good and fine and well and fit. This is Sami, the host, as always, in front of you with a new topic from a new field, presenting you the today's webinar's topic. It is how to reduce obesity and maintain normal level of body weight through the physiotherapy and nutrition point of view. Where our speaker of today's webinar is Miss Jyoti Session from Chennai, India. She is very much intelligent and has a lot of qualifications which will really help us a lot today to understand more and more about this topic. I will start with a brief explanation of our today's sections. Later, I will go for the introduction of our speaker. As our usual audience knows, that we have these three sessions in all the webinars. The first one is of the presentation, which will given by our today's speaker. When she will finishes the presentation, then we will have the a section of our guest, which is we are really sorry that we have two guests today as well, but they are also facing the internet issues. So if they will join us live, then we will take them with us, but if they will face the issue continuously, then we will take their questions only and we will not take them. And other than that, we will have the last session, which is of the question answers from you peoples, when you will question from our today's speaker. And that session, we will also paste the feedback form link. Now, what is the feedback form link for our newcomers? Actually, feedback form is the form which make you enable to get the certificate of today's webinar. We have today the registration about 130 and 120 and 30, in between 120 and 30. But what happened, we will not give the certificate to all of those who have registered. We will only give the certificate to those who will join us now and will remain with us till the end. And how we will know that? We will know that through your filling of that certificate, which is, the form, which is actually we call feedback form. We will provide its link in the last session, and we can post it, we can paste that link at any time. So I request you all to not always comment that paste the feedback form link, give the feedback form link. Just wait and keep concentrating on our speaker and keep concentrate on the topic. We will present the link and we will tell you that now we have given the link, just go ahead, fill the form. Other than that, those students who will remain active and who will ask more questions, who will reply our speaker through the comments, who will understand the things, and who will remain in connection with us through the comment section, we will ask them, we will invite them for our next webinar as the guest. And if their qualification, education is well enough to be a speaker, we can also call them as a speaker and we can give them an opportunity to first time come and just speak in front of the international audience. So now this is an opportunity for you not to only grab the knowledge from Ms. Jyoti, but also to grab the opportunity to share your knowledge with the audience. This is also your opportunity to be one to join us live in next webinar. So I request you all, I say you all to just be active and remain active to be our guest. The other way to be the guest is that you can email us, you can text us that this is my qualification, this is my education, I want to be a guest, or I want to be a speaker, or I want to be a resource person. So that depends on you. Now I will start with the short introduction. Miss Jyoti is actually currently working as a lecturer in physiotherapy. She has also worked as assistant professor. She has attended many webinars on many different topics related to the physiotherapy. Along with that, many of her research papers are published in different international journals. She has also secured the second position at the Indian National Conference of Physiotherapy 2014, which is very much amazing thing for we all as well. Congratulations, Ms. Jyoti, for that one. After that, I will tell you that our today's speaker was from Chakwa. His guest was from the Chakwal. That and I'm not introducing her right now because she is facing the internet issues. And other one is from the Bangladesh. She is also facing a few issues of the internet and the light. So if the both one of the both will join us, I will introduce them later. So now I will give my further proceedings to Ms. Jyoti and she will engage you for the 30 to 40 minutes. Ma'am, now I proceed to you.
Yeah. Thank you, Mr. Samir.
Thank you,
So
ma'am.
the warm welcome with me. Welcome or greetings, audience. So everybody is in evening. I'm making confirm. Good evening to all. So here we are going to the topic. Before that, I will introduce myself. I am Jyoti Seshan, completed Master of Physiotherapy in Orthopedic and Traumatology. Both my UG and PG I completed in Ramachandra University. I worked as an assistant professor in Wales University, that is School of Physiotherapy in Thalambur campus for past 3 years. And now present I am working in lecture in physiotherapy and consultation in NIPMed, Muttukadu, Chennai. So now here I am. We are dealing with the obesity. So here I take chosen this general topic. So here we are going to the presentation. Thank you, Sumit. So the introduction part of this obesity, we can go to the next slide, Sumit.
Yes, ma'am.
Yes.
Sure.
So introduction part. Obesity means what? Obesity is a chronic condition which defines as an excessive or high amount of body fat in the relation of the lean body mass. So your as a WHO also stated definition as you are seeing in the screen, that is overweight or obesity is near normally same, but it is quite differ. Are the definition of abnormal or excessive accumulation of fat that presence is a risk for health. So accumulation of fat can be, it can be over any body of the part, but especially over the tummy region, or especially it is more, then we can see in the upcoming slides what will be the risk factor and how the obesity is caused and how what. So next is epidemiological trial. So in this epidemiological trial, the first beginning in 1975, the worldwide they found as a triple. The spreadings of the triple way, the obesity or overweight also. And apart from this, I just referred three articles like 2016. The article were published. So the article one as the I mean in that population, overall population, 1.9 million peoples were having at the age group of 18 years, where obesity as a confirmed, and along with that population, around 650 millions were stated as overweight and obesity too in that age group 18 and above. Okay. Then the second article, same 2016, were published at the age group of 18 and above, the adolescent and adult age. So there the 39 percentage were overweight and 13 percentage were obesity. Third article, same year 2016. So here they found concluded as the 340 million peoples were as a this age group is quite different, because they conform with the children and adolescent at the age group of 5 to 19 years. So with the children's and adolescent age groups, so there were obesity and also overweight were present. So the conclusion came. Apart from this, recent study were done in after COVID time. We faced in the COVID 19, that is 2009, in 2019. Later on that 2020, there were the health related articles were stated as 39 million children underweight of 5 years where overweight and obesity were concluded as the epidemiology trial. Apart from this, over 4 million, as you are seeing in the screen, the 2017 in the year, according to the article of global burden of diseases, they stated as 4 million populations were dying, the peoples were dying due to overweight or obesity. they uh, the obesity or overweight is very much stress to the peoples. So I think mind level, the physically and mentally were disturbed. due to in this population. And from I stated as 1975 to 2016 as the whole this age the year, the what the prevalences were taken as a study. The overweight and obesity in the age group of children and adolescents at the age group of 5 to 19 years were increased four folds. That is, more folds were increased. That is more than this. So 4% to 18% as globally they are stated. Next slide, Samir. Causes of obesity. Causes. First causes is genetic factor. In this genetic factor, what will happen, the hereditary and genetic factor is near normally same, in that the person's height, weight, and the body fat distribution and metabolism will involve. In this, many research study were stated as the impact of the obesity or overweight is impact 50 to 90% as a genetic factor in most of the people population. And also in the genetic research, there were stated as 35 35 gene, also set point theory were stated. So in that, what we can see to that 35 gene means what will happen inside the mechanism, as they around some population they were doing the research. So I think around 340 million of population. In that human, what will happen inside the body, the genetic wise they got obesity. So what happened, the obesity they told means the final conclusion of the article research means the human metabolism will get slowed down. So due to that also the body fat will be the four folds is increased as a obesity or overweight as a genetic point of view. And in set point theory, what it states, set point theory means it is a state of the gut and the brain hormone, which three is involved, the enzymes, hormone, and the brain. Three is involved related to the our gut, that is human gut. So these are the thing. And the set point theory as management also given, we can see to the upcoming management slides also. And second, no, the same slide, Samir. Second one is environmental factor. In environmental factor, here the whatever the false things that the prawns or cones, so we can say that. So here the environmental factor means the child, for example, if your child is coming from the the play school or from the school, so they are sitting in front of the TV, they are eating the snacks or eating the ice creams, that should be modified. So the behavioral modification strategies is following in the environmental factor. Then third one is obesity caused by the disorders of hormonal glands. That is, hormonal glands means first one is thyroid gland, that is hypothyroidism, the thyroid which is present in the front portion of the neck, that is anterior portion of the neck. So here what will happen, if the thyroxine is the which is the substance is controlling our metabolism rate of the body. So also the basic metabolic rate, BMR. So what will happen if your insufficiency of thyronex or thyronum in your body, that is the thyronex especially we can say. So that if it is slow, if it is hypo means less. So what will happen, it will automatically slow down your BMR, that is basal metabolic rate. And it will also result in the calories which is burning out mechanism will be reduced. So the symptoms of hypothyroidism, the whomever it is, the female or male, whomever it is, they are facing like obesity and resistance to the cold. And also some women will say that facial hair is grown up. So like that way the complications will be more. And also if we are going to the doctors, they will prescribe the thyronum or eltroxin, the supplements for the thyroid secretion inside our body. So, and also it should not be taken for prolonged period, and it's also having the side effects. The heart disease and side effects of the drug will be heart diseases will be landing up, and also you'll have nervous disorders will be landing up. So we can take with that part to the hypothyroidism. And second point is Cushing disease or Cushing syndrome, that is adrenal gland, the adrenal gland which is present in our body, that is two kidneys above. So what will happen? The adrenal gland is the gland which it will secrete adrenocorticotrophin hormone, and by the benign monoclonal pituitary adenoma. So if it is excessive, the secretion of the ACTH, whatever I said, so if it is excessive, then what will happen? It will, the cortisol, it will secreted more also. In the cortisol, it will land up in the fire burning, or the what we can say, the calories burning mechanism, that will also be ready, the mechanism will be reduced, or it disturbs to that. And also your circulation of the cortisol will be I mean excessive more. So you will have land up in a, the conditions which is for sorry, the symptoms which is in the Cushing syndromes will be stretch marks will be there present, and you have the skin, the fat tissues formation in excessively. So it can be divided as a central and peripheral too. Central means the metabolic complications will be there, and in peripheral means as a visceral or peripheral. Visceral part means the altered adipokinase secretion will be there, and insulin's also secretion will be resistance will be there present. Then inflammation in your body present, fat accumulation in all over the part will be present. So these are the syndrome or Cushing disease. Then polycysts ovaries, PCOD or PCOS, more females are facing in this generation. So here the PCOS, the many researchers stated as PCOS along with type 2 diabetes are more commonly facing the obesity or overweight, as a research stated. And what it means PCOS means the excessive I mean presence in the balls, or the presence inside sorry, externally in the ovaries. So what will be happening if they are PCOS present women? There will be high rate of glucogen will be present inside, intolerance will be there, and defects in the insulin action will be there, and beta cells function will be also there. So if it is the reproductive part is affected, or the menstrual cycle will be disturbed also, like irregular menstrual cycle will be there, one condition. Second two condition also, here also the patients will say that facial hair growth, and any hormonal changes, the throat, the voice, the female will say that so many complications in the PCOS also. So there will be supplements we can give, the I mean the estrogen and progesterone. And also the high rate of glucose intolerances will be there. So the insulin level balancing, they will be giving also the insulin injection, or in the form of tablets as a pills. So to regulate the menstrual cycle, and to reduce obesity in a healthy way, as without any drugs, that we can do that. And last, diabetes. In that diabetes, what will happen? The diabetes means it is a beta cell function, and impaired to that, and insulin resistance with along with that will happen. So it will land up in a diabetes mellitus, as we are seeing the all male and female are getting. Female used to get especially after delivery, but so many females are getting due to genetic wise, as a father is having a diabetes or mother is having a diabetes, they will get early the borderline diabetes mellitus, they are concluding before marriage or before getting a childbirth delivery. So now what is happening? This means the amount of non-esterified fatty acids or free fatty acids or glycerol, hormones, cytokinase, pro-inflammatory substance and other substances that involves in the development of insulin resistance are increased during the diabetes mellitus. So this what will happen? This will also land up in trigger your appetite. So you some people will eat and will not get satisfied as a fullness of the tummy, so they will trigger and eat more. Usually they will eat more sweets, as we can see to that they cannot control eating the sweets also. And also what will happen? The burning, usually the fat burns should be there. That is obesity means fat burn should be there, and glycogen or glucose should be burned out from your body. That will be maintain your balance, BMI, body mass index. So this will mechanism will disturb in the obesity as well as also in hypothyroidism also. These are the major causes of obesity. Third one we saw. Fourth one, obesity causes by medical drugs. Medical drugs is especially examples oral contraceptive pills. Apart from this, the combination of especially the oral contraceptive pills means why, due to that estrogen or progesterone supplements, if it is excessive dosage, it will land up in your the triggers your uh, the appetite, or triggers your hungerness more and more. So they will grab food more and more. They won't feel that satisfaction also. They will eat till the tummy is getting full. So that one thing. Apart from this, if they are, I just added a few points also in the medical drugs. So apart from this, they will taking alcohol and smoking. Nowadays women are also smoking, women are also alcohol consumption. The alcohol content is very higher as a whatever the types of the alcohol, either it is a drugs or it in the drug form they are taking alcohol, or otherwise a liquor or the wine or beer they are consuming more than 7 times per week. If they will land up in a obesity or overweight, the fat accumulation in the tummy. And apart from this, smoking, what will happen? The magitunia, that the content which is present in the smoking, so that will trigger your appetite, or the, and also it will both simultaneously, what it will trigger your appetite as well as it will also the calories burning mechanism will also disturb, and it will also uh, the center which is present in your brain, that is hypothalamus, that will also be get disorders any related to that. So it will majority three concept, the smoking and drinking will land up disorders, and that will have result you as a overweight or obesity. These are the medical drugs. And last one is obesity caused by disorders of the brain. That is especially major hypothalamus damage, that is due to trauma or cancer or inflammation. Here the majority, the hypothalamus is the control as a safety, as you are conscious with the environment, and also the hunger part, that is your appetite. So what will happen if you are if any person or the patients, if you are seeing in the ICUs or any hospitals you are treating as a hypothalamic damage or disorder, so what will happen? The hungerness, they will eat more and more foods. They won't feel the satisfaction also, and psychologically they will be also some depressed. So here they'll be landing up in the obesity or overweight. And next slide, Samit. Yeah. Eating disorders, as we know that bulimia nervosa and anorexia nervosa. In bulimia nervosa means what it means the hypothalamic disorders, as I stated before, and irregular menstruations, oligomenorrhea. So this will be happen, and what it will land up in. So uh, here at the age group of the population, usually the adolescents are more facing this bulimia nervosa. Here more eating, like today's peoples where we are ordering more in Swiggy's, Zomato's, as we are enjoying the junk foods more than the organic food. Due to the corona only, we are not ordering much. But after post corona, we are ordering more and more the junk foods as Zomato and all those things. Then, if we are going to the marriage or any parties or anywhere, they are eating more and more because they are very the foods junk foods are very attractive than the fresh vegetables and fruits. So we are eating more. So if they are the person, he or she is having the bulimia nervosa, they will have the more they consume the food, they feel like bloating tummy. So the symptoms will be like bloating tummy and excessive uh, skin also excessively changes will be there, like due to this the stretch marks or due to this, so the skin changes will be also present in the bulimia nervosa. And with that I concluded the bulimia nervosa. Then anorexia nervosa. In anorexia nervosa, same the adolescent person where the hypothalamus suppressant will be there, but here amenorrhea will be present as a same irregular menstrual cycle. But here what will happen, they will land up in lackness of eating. They won't eat much, they will eat very less. So what will happen, it will land up automatically malnourished or malnutrition. Or if they eat also, the sufficient food is not utilized by the body, metabolism cycle will be disturbed. So that will be land up in the anorexia nervosa. And hypoprotein lipase. So here LPL, here what will happen, this will be adipose tissue, the metabolisms in the obesity were increased. So the activity of the LPL, the rate of limited enzymes in the triglyceride will be assimilated. So here the mechanism. And apart from this LPL, so here this lipidemia in obesity were there. So here what will happen? The lipolysis of the TG is rich in LPL. So here the obesity will have, what will happen here? There, thereby reducing mRNA and will land up in the reduced the skeletal muscle activity in the LPL composition, and also the VLDL and chromomicrons activation along with the LPL will be reduced. So these two are the major things. So here the muscles activity, the skeletal muscle activity is lacking, means what will happen, the patient will land up in inactivity or impaired. They will be very lazy also. The mindset will be very lazy, and physically also they will be lazy, the LPL. Then leptin gene. In leptin gene, there is a hormone called leptin, which is regulated the body weight, which will help for us. So if the fat accumulations is more, then the more production of leptin should be present. But the leptin, in case the condition is there, the leptin production will be very less. So that will have lacking of burning fat or burning calories inside the body. Samir, next slide. So then determination of energy requirements. This is the major part. This 3 points is very major for obesity or overweight, maintain or control. Energy balance means the mechanism, what means the energy amount of calories which you are consuming is equal to the energy of expenditure should be there. That is a neutral energy balance. Or the whatever I mean which you are consuming as a calories, as a food, carbs or starch, protein, whatever it is, it should be expenditure or it should be utilized. If you are consuming the protein or the kind of things, the total, I'm saying the nutrition perspective. So here that should be utilized by your body, or otherwise it should be as a toxic substance. If it is not required or any toxic substance, it should be expenditure. So this is the neutral one. Otherwise, if it is positive, what will happen? The positive means the more calories you consume, less calories is expenditure. That will happen is weight gain. or it is negative, energy balance requirements is negative, means then your consuming calories is more, and what will happen, your energy, sorry, energy expenditure is more and you are consuming calories is very less. So that is what the negative energy balance, which will land up in you as a weight loss or malnourished. The weight should be, the BMI should be in a normal way. It should not be above, that is overweight or obese. It should not be below that. That is a malnourished, malnutrition in that way. So it neutrally balance, neutrally maintaining means calorie intake is equal to calorie expenditure, and components of the calories expenditures means this what, how you are totally like total energy expenditures, we can say that is a daily basis of some amount of calories you are taking daily basis, how much your expenditure in three major components, we can say. One, your calorie expenditure at rest. Second one is calorie expenditure during your workouts or physical activity that you are performing. Third one, energy expenditure during your digestion, absorption, and storage of food after you are eating, or a whole meals you are taking up. So this three will be major composition for calorie expenditure. Fourth one is estimation energy, that is calorie need and no, Sami, the same slide. Energy needed and expenditure. So this here means what will happen here. The method of provided has just an estimation and value for maintaining the, I mean the calories or energy in your body as a way maintaining your current weight. So in the form of, if you want to lose your body weight or you are in the process, then your calorie intake should be in a very moderate level or at the low level. If you are taking too much carbs or too much starch, that if you have to do some workouts to burn off. Otherwise, if you are inactive or physically activity is very less, then your calorie expenditures will be very less too. Samir, next slide. Yeah, here you are seeing that the types of body fat or belly fat. Here the six types of body fat is there. One is, the first one you are seeing is the, from the neck to the hip level, you are seeing that. So here what will happen, so the upper part of the fat accumulation is present. Here this is due to overweight and consuming of, I mean the sugary foods you are consuming nowadays. There is a soft drinks are there, sugar rich, and sugary foods are so many sweets, donuts. You are consuming more excessive amount means there will be a excessive amount of fat accumulation in the upper body part, as a full upper body fat is present. The first one. Second one, their area they mentioned in the orange one. So the lower abdominal fat, this lower abdominal fat is especially due to, why it is causing, due to stress, excessive stress or tension in your office or like working sector, always in the family, both you have to handle both. So you're getting depressed or anxiety, due to that it can be happens. And the third one is near normally your chest portion and your lower abdominal portion is I mean the landmarks is present. So here the large tummy and the upper body fat is also present. So here what, how it is how it is causing, due to physical inactivity. Physically they won't be very active, they'll be less active also. We can say that we usually, our mothers will scold as a very lazy people, you are sleeping and waking up in 8 o'clock and you need a coffee at the bedside. So that will be lacking of physical activity and means as a laziness. And and the rest of three are women's. So the 4, 5, 6. The fourth one is for the lower body fat. Usually the females will facing that, also men, but the especially more prominence the type of the belly fat is seen in majority female. Lower body fat is due to excessive gluten in deposition in the body, and also in the diet also. While you are taking consuming gluten substance is more means, then you will gain the fat in the thigh region and buttock region. And also the fifth one is the tummy, that is a swollen stomach or swollen tummy. This is due to what? Excessive consuming of alcohol, or due to, also we can say that smoking also. Some amount of alcohol contain and smoking, the substance which is inside alcohol, smoking, so many, it will land up in obesity as a swollen stomach or tummy. And also this will result in, or it will risk factors land up in increased breathlessness. If you are climbing their stairs, only the 4 stairs they will climb, they will feel breathlessness. Or few distance, only the short distance they will walk off, they will have breathlessness, they cannot do the activity or workouts much effectively. And the last one is a lower body fat, along with included your both lower legs. So this will be due to hereditary, your gene wise factor, we can see that. Apart from this, you can see during the pregnancy, that is post pregnancy time, we can see that. So next slide, Samit. Yeah, here we can, till now I saw, we discussed here about the causes and types of obesity. Now we can see about the measurement of the obesity. Here there are four types. One is the body mass index. Samir, one second, next slide. I have shown the normal. Yeah, this is the thing. As WHO classified, stated as the obesity, for obesity measurement, BMI, body mass index. So here underweight means below 18.5. Normal weight is 18.5 to 24.9, and your overweight is 25 to 29.9, near normally 30. But if you are exactly 30 and above, means that is they concluded as obesity. So there is a borderline of the obesity, and obesity is classified as a 3. Class 1 is 30 to 34.9, and class 2 is 35 to 39.9, class 3 is 40 and above plus. Samit, previous slide. Yeah, so the body mass index, I shown the formula here. So the weight by height square, so we can see the kg or lb, the weight, and the height will be in m square or inches square. So in inches square means into 703, we can do that calculation, and we can see our weight and height, the BMI ratio. Then skin folds here, what is I the shown in the picture below, we can see the caliper. That this caliper what means, here, um, the skinfold caliper, the name is herpetens, and slim glide langes. So this is the names of the caliper. So using this caliper, so in European, the article were stated in 1996, it should be, the measurement should be 0.1 mm. So the normal skin fold of, I mean, if the patient is obese or overweight, it should be 0.1 mm exact weight. That will be normal, neutral. If it is excessive, means it is a overweight. If it is under also, it is, we can say that underweight, we can say to that. Okay, so the normal scale interval ratio is this much, and the constant pressure of the caliper will be 10 g per centimeter cubes. So this will be the normal constant pressure of the caliper using the skin fold measurement. And west circumstance, in west circumstance we can measure that, take ask the patient to stand, and in the west, usually the exactly over the umbilical level below that, we can take the west circumstance with the inch tape using, we can take that. So we can see, if everyone is after finishing my classes presentation, you can see to that your west circumference. Along with that, you can go for it. Usually we can see the west circumference in purchasing your jeans, jeggings. Ladies usually will do that. So that, and for a west hip ratio is the best measurement for the obesity, as the normal west hip ratio is 0.80 for the women and 0.95 for men. Usually the normal west hip ratio. West, we are taking the west circumstance as a same measurement we can take. Along with that, the hip measurement, the lower level of your, that is the your thigh level, so we can take along with that. Exactly, the hip region means you can say to the thigh level, both thigh levels you are taking, and then do the ratio. You can find it out both. With that, you can see to that note with the the recording sheet, you can note it, the west hip ratio. Along with that, you can have go a obesity reducing training. After later on, the west hip ratio same, you can take a measurement and have a recording sheet, you can have that. So you can see the differences, whether I am obese or not, or I am any have changes or improved. Samir, next slide. Yeah, the weight management. Yeah. So here we are seeing the weight management after the measurement we are seeing. So in this, the set point theory, as I saw in, we discussed in the genetic factor as they stated in the article. So in set point theory, the behavioral modification, especially if your child is coming and sitting in front of the TV and eating snacks or ice creams, instead of that, you can change, switch off the TV and have a apple or fruit, fresh fruits, or you can make it as a creativity. The mothers, you can, if the apple is boring or this, so many creatives are came. Apple chat, fruits chat, fruits pizza. So instead of that apple, we can make it as a sweets, or so many cooking, like that will tend to change their behavior. And in usually the set point theory, as we are in our old age, our grandmas or mothers, usually they knows that very well. They will show the natural sceneries like moon, sun, and stars, and then they will show the birds and animals around the roads side. They will feed us, and so the child will usually change and interact. And with that, the the usually the set point theories work in that way. It's very good level. And also one more point in set point theory, as your behavioral modification in that, in my personal ideas also I am sharing here. That is what means, one is chew your whatever you are chewing, count your chews, how much. If you are chewing, or if you are taking a one spoon of the Kellogg's uh, cornflakes, anything that you are biting and chewing, one time, two time, so you can count your chews. So then you will automatically, what, next day you will count automatically, and you will see that whether I am intake of quantity is more or less. That we can have the behavioral modification, and also added up the additional points. Then exercise prescription, as we can see to the upcoming next slides. Samir, next slide. Nutritional, the major nutritional management, as we can see the end of the session, that is a dash, the score or the scale, which is guidelines is given as a standard scale. uh, and now we can see the health, good health and well-beings of the five foods, which is very important. Bread, usually bread, raw bread, you should not take that. You should be cooked well, that is toasted, or we can add up any vegetables, fresh vegetables. And we can have, in case if your fresh vegetables is not there, then They can add up some kind of cheese or some fruits as like pineapples, so we can add up that and we can have that bread. Celeries. Then meat and fish should be with the mixture of the vegetables only. Along with that, if you are taking, the calories will be more in the non-veg meat and fish, so they are taking. Apart from this, it's okay for taking that. It's rich of protein and vitamins are there present. Also egg content is more we can take. You normally the articles, nutritional articles, they are saying all some here the vegetarians are getting more, are the osteoporosis or early stages, so they are usually they are asking, the doctors is prescribing as a nutrition dietitian point of view, so they are referring as take any egg if it is possible, or indirectly as a mixture of cake wise, the form of cake. I'm saying giving some examples, so we can have that. And dairy products, the milk products, nowadays its milk is okay, good, but somewhat it's good, somewhat it's bad, but you can take. It's a boiled means you can take. Some people are landing up in a lactate intolerances due to the daily products, that is a raw milk consumption or any rose milks in the form of it is not boiled very well. Or you can take it better, you are taking a milk products, as can make sure that your home if you are taking is very good. That is why because you will be boiling, it's good, the bad or toxic substance which is present in the bacteria form, it will be destroyed, so that you can take it as a good form of milk or the daily whichever daily products. And yogurt and the curd, like buttermilks or yogurt, so in the some form of you are taking means that you can take in your homemade mode. Excuse me. And butter and table of margarines, this you can take it, very good for the health of the females usually. Excuse me. Then fresh vegetables and fruits is that you can also take it, that is very very important and mandatory for the nutrition point of view. Excuse me. You can drink plenty of water instead of soda, alcohol, or instead of any soft drinks, sugar high rich drinks. Instead of that, you can drink plenty of water. So the normal value I mentioned here, that men will be 3.7 liters and women will be 2.7 liters per day. Samir, next slide. Samir, next slide. Yeah, the content of the calories should be, the protein should be 20 to 30 percentage, and the carbohydrates complex should be 45 to 60 percentage, and the fat will be 15 to 20 percentage, very less only. Samir, next slide. And here the management of childhood, the obesity, as we are seeing. Excuse me. Yes, here for management, especially for the child, so regular intake of fresh, uh, the fruits or the supplements which they are intaking. And physical activity will be more and more you should be like how, what I will see, I will show you the next slides also. First we will explain this. And the physical activity, how we can have the 60 minutes, or yes, 60 minutes, the one guidelines is there, so we can follow that. And apart from this, you can have pre conception. And also if you are getting pregnancy, you can be very conscious, as your child should not get obesity more. If usually the so many pregnant women, as during the delivery the child is the kgs is more, then the child will usually after growing up, or the during the growing phase of childhood, the child will automatically consume the sugar content more, as we are seen in 2 3 studies only, very rare studies, but you can do it furtherly research studies. I'm also working off, if any audiences are there as a professionals, they can put studies as this one. And also early childhood obesity will be prevented due to the physical activity is giving more. than the laziness avoidance. Also, if we can have from the school and from the preschools, the child is coming, have the relax. They can sleep also. They need a good sleep, resting time. Good sleep is till 6 to 8 hours. 8 hours is maximum for the child to have a good concentration, memory power improvement. They will be very much active in the day. Also weight management, we can see to that. And more of that, few articles where I see that obesity is landing up the child or childhood, whomever it is, concentrated or memory power, it is very disturbed also, the obese child. So that is what. So we can have more sleep, encouragement, and also physical activity too for the child. Intake of rich fresh fruits and vegetable supplements to the body metabolism improvement. Samir, next slide. Yeah. In physical activity, so here I told the 6 minute every day, the guideline screen. So sit less, move more. Usually we are sitting in the COVID time, the post COVID time, we have to do this only. This is the best physical activity that we can do. Apart from this, we can have added up for, especially we added up for the children and young people age of 5 to 18 years. Apart from this, we can add it up to the whomever it is working in the IT sectors, people sitting in front of the office, there is a laptop or screen which is present in before them. So we can modify that also, the like 60 minutes something they can do, walk and come. They can have drink some water or coffee or tea, but make sure you should not drink caffeine and tea frequently, more than 2 3 times per day. Hardly one time is enough. You can instead of tea, that is you are adding up with the milk, or coffee with the milk, that is cappuccino, espresso, like that way, you can have green tea. That will be good for health and burning of your calories the good way. And so this is the the child and the youngsters, we can follow this. The playtime or the walking or running time or swimming, we can have skipping, skating, climbing, or any other thing, the fun play, that's usually we will take them to the mall or the place which they are fun area or fun play, they'll be there. So they can actively participate in that. Or otherwise, if there is having in the school itself the activities there, any sports activities, that active travel or any cycling activities, any PT periods is there, any workouts inside your home, if you are doing any workouts in the treadmill, so you can they can usually they will play and follow your the way what you are doing. So that we can do. And dance is the best energy expenditures. That now recently there is a introduction of Zumba dance, so that we can enjoyly participate that. The mothers who are after delivery time, they are actively participating in Zumba dance. Also the child, if they are interested in dance, they can also participate. The child which is uh, very frankly saying, the child which is from the childhood level and growing up till the adult, who are Bharatanatyam, they are maintaining their BMI, body mass index, in a healthy way. And also music means the way they will sing or talk. The energy is expenditures like in speaking. So what will happen? How it is happening? The energy expenditures. While your jaw muscles is activating, your brain will automatically stimulate and give your energy. That is whatever calories or glucogen which your muscles or the muscles which is activating. So they will speak and they will sing, or they will take a nice voice. They will get it. So that will be interested. One activity, if you are engaging them as a playing or hockey or cricket or tennis, volleyball, swimming, anything that it will actively, we can do that. Apart from this, they can go for child swimming training also. Swimming training is very good for the body. Also, it will regulate our cardiorespiratory endurances and it will encourage our muscles to enhance, like improve our muscles functioning, and it will also energize or boost up our mood or be active in any way. So be healthy in a good way and improve develop our coordination too. So this will be that. And also in swimming or aquatic therapy will be used as a cool down phase in the whatever we are prescribing the exercise prescription for obesity or weight loss program. So in the cool down phase, why we are giving this swimming or aquatic therapy means to cool down phase, as they are very much tired of doing all the workouts, push-ups, sit-ups, so many things, etc. They will do that. So they will, automatically they will cool down phase means they will need the relaxation as the swimming or aquatic therapy. Samir, next slide. Yeah. As we see before the slides is childhood period, now it is adolescent period, above 18 and plus. So in adolescent they are facing usually obesity causes means highly calories intake, that is sugar content intakes more, and sedentary lifestyles is more changed, that is they are ordering instead of the fruit salad or vegetable salad, they are ordering in the Swiggy and Zomatos, the pizzas, burger, so many things they are added. And some people are quitting the lunch, quitting the breakfast. Yes, they won't have the food also. Like near normally they will be like fasting. What will happen in fasting? It will end up in obesity only, obviously. Good fasting is means one day fully if you are staying fasting and supplements your what we can say, the food or whatever it is, like vegetables or fruits or juices. So this kind of thing you are supplementing, as then you are in fasting means that will be good for your health and the metabolism too. It will work out and your calories burning mechanism will be maintained, and your energy expenditures will also be maintained. But you are unnecessarily you are skipping the breakfast, unnecessarily your lifestyle changing, you're skipping the breakfast and having your lunch as a pizza or burger or anything, that will not good for your health. That will fat accumulation is, it will increase high. And what will happen automatically, what will happen means you are not having your breakfast, you will have the lunch means you will not stop with one plate of dish, you will have more plates. Automatically what will happen, will end up in obesity only. That is the sedentary lifestyle should be modified, and your behavior also should be modified, at seeing the cell phone and eating, seeing the any cereals or eating, that should not be, it should be completely avoided. And midlife weight gains usually especially that adolescent age group is attaining puberty and getting menstrual cycle irregular, anything irregular or regular basis. If any, if regular basis means it's normal, but irregular basis means they should be having the land up as a obesity or overweight. And hypothyroidism, as adolescent females especially, they are suffering as more hypothyroidism and irregular menstrual cycle, also land up in the obesity. Hereditary, that we can see from the mother or father, usually mothers, the hereditary will come to the female, the child, which were adolescent and attaining the puberty period. So they will have the obesity. And also using some drugs, alcohol, or any sleeping, some people sleeping pills also they are, some people some girls where the contraceptive pills, the estrogen or progesterones they are taking, that will have. Some also for migraines they will be having, any other issues in the body, migraines. So that will have, what will happen, the drugs which they are consuming. And also I will add up a few points due to that drug consuming. They will automatically, what the normal peoples here they are consuming as a germs chocolate, no, they will eat, or they will have some toffees to have a refreshment, like that they are eating the paracetamols. So if you are eating unnecessarily unprescribed by the doctors, you are eating the paracetamol drugs or excessive amount you are taking, that will store in your liver, and liver also get will spoil damaged, and your appetite will also get damaged or triggered or anything, and your burning of calories mechanism will be lost, changed. That due to that also will be overweight and obesity will be there. Samir, next slide. So for the adolescent age groups, the male and female, whomever it is, aerobic set of exercise we can give. Also, we can give anaerobic part. I will say why, how it will be. I'll explain in a detailed way. Now, aerobic part. Aerobic exercise means why they are giving means. Aerobic means what? O2 required exercises. Oxygen. O2 means oxygen required exercises. So there is a moderate exercise can be prescribed. Moderate means brisk walking, cycling, jogging, swimming. So like that way we can, or if you are using treadmill or orbitaclite cycles, anything that gym part we can also add it up. So it will, what will it will result means, it will improve or enhances your endurance uh, training too, and also it will encompasses your heart and lungs, and your blood vessel circulation will be maintained also, and especially your fat burns mechanism will be boosted in the aerobic exercise prescription. Examples are I mentioned there before. Again I will mention that walking, jogging. Walking means brisk walking, not in a dull or mood, or why should I walk, sleepy they will walk. No, 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 no. Brisk walking, jogging, cycling, swimming. Swimming we can have or not. Either I will give the option. But this three, the starting three, brisk walking, jogging, and cycling is the aerobic exercise part is very good. And you can also side by side you are encouraging your cardio respiratory endurances too. So this will be very useful for them. Also, we can have that anaerobic exercise. For adolescent, we can prescribe anaerobic exercises. This is without oxygen. We are doing the exercises anaerobic. So this will be high intensity exercise will be prescribed for the adolescent population that will produce short burst of the power. So what will happen inside your body, the mechanism, it will burn up your glucose or glucogen which is present inside your body, which is not burned off as a calories. So this is what the anaerobic. Only for the adolescent age group. Why? Because the geriatrics or adult age group, they cannot do that anaerobic exercise. They will be, some people are above 70 or 80s, they are degenerative phases. So this is a growing phase till 21 years old. Till 21 we can say 25. Till 25 years old we can give the aerobic and anaerobic. Also strengthening training. So like with the resistance, without resistance. If with resistance means we can use a I mean weight cuffs or the dumbbells we can use 1 kg. If you are continuously practicing, use that. If you are lazy, don't use that also, because your muscle will get somewhat soreness, or it will the fatigue, or it will happen, that is your muscle capacity will be reduced, or your muscle will get tired due to that. So unnecessarily don't start with the beginning itself you are starting with the dumbbells or very strength high intensity training, don't start with that. So there is a strategies, what means, first 10 to 15 minutes of warm up. That is your warm up means you can do the stretching activity. Stretching means you will gain the, I mean your tightness muscles will be go off, your muscle will be smooth to activate of the main workouts phases. It will be very pre ready for the main workout phases. And pre-workout we can say that the warm-up phase, and the main workout phase is you are giving any, for example, circuit training, or in interval training will be useful for adult. Circuit training we can give. Circuit training means 30 minutes of sit-ups, rest for 30 minutes, then 30 minutes of sit-ups, then rest for 30 minutes, same 30 minutes, rest 30 minutes, rest, and then next 30 minutes lunges, 30 minutes rest. 30 minutes we can have the again lunges, and then running or jogging we can have, then 30 minutes rest. Then 30 minutes we can have the any other, say any other step ups or any push-ups we can have, and then we can give a rest. So this is the main phase of workout. Then end of the thing is the the conclusion or post workout phases is cool down phase. Cool down phase we can give the same stretching, or also we can give the the swimming or etc. Then the strengthening. Yeah, yeah, next slide. Then adolescent or geriatric obesity. Here, due to this, how they are getting, the causes will be inactive. They are already degenerative, so they are very much inactive and hypodynamic. Then they'll be eating is a too much or too less. If any person is eating more, we can have the eating disorders. We can say that. Usually, some geriatrics, I saw few geriatrics only. As a personally, I'm saying few geriatrics only eating more due to that diabetes. They will eat more. So having the sweets, especially sugar-rich foods, and stress, especially stress is the main causes, and depression, psychological issues. Then genetic and geriatrics predisposition. Then endocrine, that is your kidney or your nephrology part, your diseases, anything is there, that will land up, usually diabetes mellitus, that will land up in obesity. Hypertension, land up in obesity. Certain medications, if they are taking certain medication drugs, that will too land up in obesity. What will happen, the sugar, the metabolism disorders, and it will also, the burning of calories will be reduced also in the medication. Then unhealthy foods and skipping meals also. They are eating too much is without wasting the food, they will eat too much. And poor sleep disturbances will be there. Hormonal imbalance during the aging phases will be there. So next slide, Samit. The exercise prescription for aged or geriatric population is aerobic exercise or interval training. As I mentioned the before, aerobic, what will happen? So with interval training means you can give jogging for 10, walking, brisk walking for 10 minutes, and then have a break or rest period. Then like that way. Then these are the things. So I'm thanking you here. So these are the one good question for here. Burn fats, and this is the thing. And lastly, Samir, you can present it before. No, no, the slides we are presenting, the dash scale. You can slide it, move it upwards, because the first one I just mentioned is for the 1600 calories and 2000 calories and 2600, 3100 calories. So this is the servings I just given for you all. You can see to that milk products and the poultries, fishes, how many calories you can servings you can take. You can make sure you can note it down that usually the normal calories is for child will be 1000 calories, and for women means 1200 to 1300 calories, and for men is 2100 you can we can take if you are working out or if you are doing any physical activity after taking any this servings is, or you have to burn out. So that is the conclusion of here. So I am thanking you, and also Samir, I am really thanking you that for giving this opportunity, and whomever listeners also, thank you. Something any
Thank,
benefited?
thank you,
Yeah.
ma'am. Actually, the session was very much informative and wonderful, and hopefully, the audience has also gained a lot from you. So now we are moving toward our another session. We have already a lot of questions in our comment session from the person, namely as a lifeline. So before we go for this one, I want to excuse you all that our today's guest is facing the issues right yet, so we can't join them. So we have their questions. First, we will take their questions, then we will move to ask the audience. So I request the audience to post your comments till we are getting the question of our today's guests. Ma'am, I am presenting questions. and they will in
Yes.
front of you on the screen. Just give them a glance. Here is the first question, ma'am.
Yeah. What connects the obesity and infertility? Okay, obesity means usually the hormonal imbalance that I told you, that in the hormonal, the estrogen and progesterones, which is burning out your fat and calories. So infertility means usually there the obesity is a one factor, that your menstrual cycle for females, menstrual cycle should be very regular, and your fat burns or glycogen which is present in your body should be maintained in a burned out, the calories should be maintained. So your gut and your brain is involved, and your hormones, enzymes are also as involved. So this is the related answer for this. Is this obesity is connected to the infertility or the fertility, which is if you are excessive weight, or if you the posture, that your physical appearances, as I shown in the type of obesity, your physical appearances will change and your posture will change, and your the uterus will get too compressed or too weak or too loaded of your weight. So that should not be happened at. Or your tummy, if your the fat accumulation, your tummy is excessively loaded, and you'll be the uterus is getting more strain, or anything more the workouts is given to the uterus, then the infertility will be can be happened. Or fertility, if the fertility is happened, that you have to maintain your body weight or BMI, that is impossible. I'm saying that surely it is good for the mother and the child too, as during the delivery. I think I conclude I
Okay,
given the
ma'am.
correct explanation for the doubt. Next
Okay, ma'am.
doubt, Samir.
Here is the other one, ma'am.
Yeah. Is it is safe for slimming pills to reduce obesity? I am strictly banning this because drugs is too effective. I know that drug is very too effective, but it will slim you faster and it will land up you as a side effects. Don't take the
Okay.
pills and all. Take it as a very rich, fresh fruits and vegetables. Organic way. I am saying that you have to reduce your weight and also physically fit. You have to be. Next doubt, Samir. I think
Yes, ma'am.
I
Now we are
answered.
going to take the questions from our today's audience, and then
Yeah.
we will take a few questions from the registration forms as well.
Yes.
So
Yes. Yes. Go ahead.
here is the question from our audience.
Audiences. Okay. Yes. Can subclinical hypothyroidism causes obesity? Yes. Yes. I think yes. The person is asking. So yes, the subclinical hypothyroidism. Usually, hypothyroidism will reduces the burning fat of mechanism. That will automatically land up what means excessive amount of fat will be accumulated, and then you will automatically land up as a obesity or overweight. I think I
Ma'am, other
clear
one
the
is
doubts. Yes.
yes, ma'am. Other
If
one is on the
yeah,
screen.
if a person is a chain smoker, can he have obesity? Yes, I'll surely say. I told the content which is present in the smoker and the alcohol consumers, the marijuana. So this content will be what will happen. It will trigger your appetite and eat more. They will psychologically have no less satisfaction after eating a less amount of calories intake, so that they will grab more food, and they will land up in accumulation of excessive bad cholesterol, or land up in a accumulation of fat in the body. So that will land up in cholesterol high level and risk factors for heart diseases, everything. I think I answered
Yes,
the
ma'am.
question.
Here is the third one from the same person.
Yeah, how anorexia nervosa causes obesity? Oh, here the type of I'm just it's a good question, and this is anorexia nervosa is malnourished. So this is not a good one. But if they are uh, I will say in the opposite way. You have to think in a multiple point of view. If the malnourished people are eating junk foods and excessively, or excessively they are having the cholesterol content rich foods, they can be land up in also the the obesity also. consumingness. So I mean in that way.
Okay, ma'am.
Yes,
Here's
thank
the
you.
key sharing to show home
Yeah.
another question.
How taking contraceptive, oral contraceptive causes obesity? Yeah. Yes, I'll answer this question. This is a good question. The oral contraceptive pills, your estrogen and progesterone, the drug contents which you are taking up continuously, that will land up in what? Automatically it will trigger your appetite. That what will happen, it will trigger you more and more, and simultaneously it will do one thing. What will happen, it will reduce your burning mechanism. So the calories or glycogen which you are burning, that should be maintain your calorie expenditure and intake. So that will be reduced here. So that's what the oral contraceptive pills, if you are taking too longer, that will land up in obesity. Yeah, I concluded
Ma'am,
that answers.
here is other one.
Yes, Samir. Can obesity shorten lifespans? No, sir, it's really not. I think it will not land up in a lifespan shorter. It can be land up like how means the disease or risk factors of your health will be land up more in obesity, as you are seeing that obese person is having osteoarthritis, degenerative phase, and if you are living also, the somewhat, if you are living the lifespan itself, will be very horrible only. That will end up in your diseases, risk factors like example is degenerative joint diseases, heart or cardiac diseases, and the respiratory, that is breathlessness, will be there. You will also feel very bad. That mentally or cognition level will be reduced also. That will be land up in. If you are that that will not shorten your lifespans. Usually, if you are living a lifespan, next minute we don't know what will happen. Very practically saying, next minute we don't know what will happen. If you are living in the short particular period, you should be very cognitively very bold and very much confidence. You have to self estimation. Everything will be good. That will be there. But if you are in a degenerative phases, you are very much a disease, you are having obesity, and you are feeling very shy. You will not go in front of any your friends itself. Like get together meeting also, you will not go there. So the psychologically very ill. So many articles were saying that obesity and cognitive impairments is more, rating scale is very very more. So that you should be very much, you're living as a short period or long period lifespans. Anyway, you should be very enjoyable and very happy and healthy way, healthy well-being way. That is what I'm saying. Yes, I
Okay, ma'am.
answered that question.
Yes, ma'am. Here is the other one. She's asking from you that you have any articles regarding obesity related to oral contraception.
Yes, I check in the website only that related the gynecology, obstetric and gynecology. You can make sure you can go through it in the Google Chrome. You can check it. Otherwise, I can have after the end of the session. I will check and I will send the link to.
Okay, ma'am. So
Yes, I
those
answered that.
who need this type of articles, they can text us, and we will text ma'am. Ma'am will share the link with us, and we will share that link with you. So, ma'am,
Yeah,
here are the
I
questions of the
answered that.
audience. Now we have a few questions, only 5 to 6 questions from our registration forms.
Okay,
So,
okay, sure.
mm, this one is the first one, ma'am.
Yeah.
I think
What?
you have already answered this type of questions.
Yes, what type of exercise should follow for the obesity? That is sedentary people's calories level. Sedentary people's both. The exercise you are following is the, you can follow circuit training based upon your maximum heart rate. I will say that maximum heart rate means you have to be very the ratio will be there. I will say that your age, if your age is example, your age is somewhat 45 or 50, so you are minusing that to the 200 and 220. So that you will get that your maximum age, that is 175. That is your maximum, sorry, maximum heart rate you will be getting. So if the person is very well obese, so make sure their minimal heart rate itself you can 60 percentage of exercise intensity you can give. Exercise intensity, I'm saying the intensity means exercise workouts. If you are giving running or do a dumbbells workout or do that in the gym activity. They cannot do that. They have to do only the minimum. Minimum means you can do the walking, brisk walking, treadmill walking. They can do cycling, very minimal duration and minimal the intensity, so we can do that. Or moderate, we can do for minimal and moderate. We can high high intensity exercises means a maximum heart rate that is 175 beats per minute. Up to that level you can see how nowadays it's very technology is advanced. I am very much wondering that the technology as a watch, that smart watch, we can monitor your the I mean whatever your vital things. So if you are attaining while you are jogging and doing all the workouts, so you can monitor that your maximum heart rate should be 175 so beats per minute. Apart from this, less means 105 beats per minute is the minimum heart rate, that itself enough. So that kind of exercises they can follow as a circuit or interval based upon their individuals maximum and minimum heart rate. And
Okay, ma'am.
I
Here,
think I answered the question. Next
ma'am,
one.
here is the question, and along with it, I am also showing the other one. Both are, I think, interlinked. This is how obesity is linked with the diabetes and cardiovascular disease. And here is the question that what should we do as a diabetic patients?
Yeah, the first question is the diabetes and the cardiovascular
Cardiovascular disease.
disease. Okay, in cardiovascular disease, how we are getting cardiovascular disease? Excessive accumulation of cholesterol or the atherosclerosis formation. That is the cardiovascular. So, what will happen in your heart vessels? You will getting blocked due to what? Your cholesterol level is high. The cholesterol, the fat content which is accumulated, the which will be stored in your heart vessels, that will block your circulation of your blood. So that will land up in what? One side, if your blood supply is not there, then what the part will happen? It will get damaged,
Okay.
obviously. Yes. So that is the cardiovascular disease. So due to that excessive your cholesterol, bad cholesterol, that is LDL. So that excessive level means you will getting the heart cardiovascular diseases or heart diseases, heart attack, cardiac arrest, like that way. And in diabetes means, in diabetes the insulin resistance, along with that I told that beta cells also, and the PPT slides I just while checking also I told that what will happen. Diabetes, one way they need to burn out the calories whatever they consume. The burnout mechanism is reduced due to the insulin resistance one. Second one is your the appetite, which you can see so many peoples in the summer time especially. I'm seeing that, in fact, in my home there is a aged peoples are there, they are also diabetes. I'm also seeing that they will grab sweets, especially sugar rich food, they will grab more and eat more, so they will end up in obesity. As if they one symptoms is like in insulin uh, the resistance is high, means they will be having the intake of sugar content food is more and more and more. But if they are controlling or they are moderating, then they can, we can see that their weight is getting reduced or maintaining a normal BMI. One. And apart from this, the second question is diabetes patient, they can do the workouts, exercises, as I can say. For aged people means interval, with interval we can do the workouts, aerobic exercises, cardiorespiratory, maintaining, especially breathing. Along with whatever exercise you are doing, don't hold your breath. Normal breathing and then do the workouts, stretching, exercises, everything. We can do that. Yeah, I think I answered
Ma'am,
the two
here,
questions.
here is the last question, then we will end up our today's
Yes.
session.
Yes. Thank you, Samir. So the last one question is, if taking oral contraceptive pills has caused obesity, then how we can educate the female, or how the consequence associated risk factors. We can take the supplements. We can give that the estrogen, progesterone secreted things. We can cinnamons, like that way. We can add up as nutritional supplements. We can add it up. Yeah, you can do that for the female. They can take with the the gynecologist or the doctors which whom are prescribing the oral contraceptive pills with their guidelines or guidances. They can take the oral contraceptive pills, but in a short duration alone. Not, it should not excessive more, or it should not land up in your destroying your liver, like toxic substance will accumulate, and it will also trigger you or land up you in a overweight or obesity. It should not be taking prolonged, like year longs. If you are taking that, I saw one example. I can say that I saw one cases, or the female girl, she is like aged puberty attained. She don't know that whether she's having hypothyroidism, PCOD, that she don't know anything. She has less estrogen secretion also, and more the male hormone secretion is there. So what happened, the gynecologist land up in oral contraceptive pills. But what will happen, the whatever, if she is taking the drugs and this thing, she is not attaining the normal kind of weight, she is gain automatically. Then we the girl automatically, what, I just referred, okay, you can do some secondary consultation to some other doctor. Then she went to the some other doctor. The doctor told why they are giving so many unnecessary pills. That is, also the thyronum which you are taking, the I mean, sorry, the thyroxine or thyronex you are taking the drugs. It should be, if your thyroid level is normal, or if you are checking 6 months once, 3 months once, if your blood checkup is done, then you have to stop that. Everything has a solution, so you should stop that. You should not take excessive. Excessive means, the food, if you are taking limited, means it is good for health. Excessive means it will become poison. That is the thing. So that you can supplement them. I think the last the person is asking the oral, she is repeatedly asking about the oral contraceptive pills. I just appreciate her, very good. And thank you
She's
for
here, ma'am.
listening also. Thank you that I'll refer that, because the oral contraceptive pills within the stipulated time, if you are taking, is very good. But excessive means it's very dangerous or risky factor for your health and well-being if they will not that. And also it will land up in other complications like heart diseases, unnecessarily nerves disorders will land up in the aging phases also. So please make sure they can supplement in natural way. Organic way means they can take lifelong, they can fiber rich foods. If they are adding up, that will be good. So that will be burned out is easy, that we can
Thank
have.
you.
And also contraindication for the foods, we can make sure they can have it, that thyroids, they are contraindication for cabbage, cauliflower. So like that, they won't take that, and then later they can do that. So I think
Thank you. Thank you,
I just
ma'am.
concluded that. Thank you.
Thank you, ma'am. Thank you very much. This was very wonderful from you, and you have
Thank you so
presented
much.
each and everything in a very good manners. And you have also given the answers very, very, what we can say, clearly, and they have understood each and everything. Thank you for today's session, ma'am. Thank you very
Thank you.
much. And at last, I will make announcement that the comment which is on the screen of the, I can't pronounce this name. This is Tishowing Tishomo. She is actually selected as our next guest, so I request her that when we send you the certificate, just contact us back. And we have also our emails on Facebook, WhatsApp number on Facebook. You can contact us there. We have next webinar on the next Sunday, so she can join us there as a live guest. Thank you, ma'am. Thank you for your kind
Thank you.
time, and thank you for. Hopefully, we will again do a webinar with you in the future times. Thank you, ma'am, and
Thank you.
thank you all the
Thank you so much,
participants
Sanjay.
to be with us. Thank you all. We are going to end this session. Thank you to especially today's guest, Ma'am Jyoti, and the participants who actively participated. And for those who are asking that share the slides and the articles, I request them that I will share the slides and articles when you will ask from for them on the what we can say Gmail or the mail, because we only provide slides with those to those who just ask for them on the what we can say on the email, because we only provide to selective people who only ask. We don't share with each and everyone. Again, I will thank you, our today's speaker who has left us just now, and to all the participants. I'm going to end this broadcast. Thank you very much. We will always have a session on the Sunday with the different topics from the different fields, with the different speakers from the different countries. So stay connected to us for more. And I will request you all to just wait for 1 day or the 2 days. We will send you the certificate soon of the speaker and of the participants and the guests as well. Thank you all. Wait for the certificates and wait for the next session. Stay connected to us. Thank you.